Welcome to Elevated, a place where the mystical meets the everyday. I am Dawn, a stay-at-home mom to a wild and spirited boy, and a guide in the realms of Reiki, Akashic Records, natural healing, and soulful living. Here, we'll talk energy, intuition, spirituality, but also the realness of motherhood, wellness, and creating balance in the chaos of it all. So grab your tea, take a deep breath, and join me as we explore healing, alignment, and the beauty of both the magical and the messy. Welcome to Elevated. Welcome to Elevated. I am Dawn. I am your host. I hope that you are having a wonderful week in October. It is sweater weather. Hoodies for me. It is pumpkin spice everything if you're into that. I'm not so much. I would rather have a tea, froth up some milk, and make it look fancy that way. It is getting colder here in Saskatchewan. Today it felt very winterish, if you will. It was 7, but that wind, it was cold. It took me all day to warm up. Today I was able to go for a beautiful walk down memory lane for my brother who has passed away. So this lady works with the high school that my brother went to. Her son passed before he graduated, and he would have graduated with my brother. Such synchronicities. She's put this walk on. It's the second year, and we were a part of both of them. She does it in memory of her son, Lane, and it's just so beautiful. She does such a wonderful job. She gets the school involved with the outdoor class, and they are a part of it. There was a lot more people there this year, which was beautiful, and it was so great to see. Unfortunately, but fortunately, I guess you could say, got to see a few people that I knew. So I got to see my old neighbor from the town that I grew up in. Her son passed away a couple years ago, and she was there, and her sisters were there to support her, and her dad was there, and it was beautiful. And her youngest sister and I, we actually hung out all the time. We were super close friends. Literally, we were neighbors. It was so good to see her. And then I got to see another lady from my work before I went on mat leave. And unfortunately, she lost her son a few years back as well. She just has this bright, beautiful presence about her. Her energy is just so beautiful, and I love it. It was just such a beautiful walk. My husband and my son and my brother's girlfriend, when he passed, she joined us. I said to my husband today, when we were putting my son to bed and we were going through our grateful list for the day, I said, I kind of feel bad that when we're walking, we don't have quiet time. We don't take in nature. We don't look around per se and just take in the beauty in that quiet, peaceful moment. We are walking and we're talking, laughing, discussing things, catching up, and having that visit. My husband and I, we looked at each other and I was like, yeah, you're right. Kenton always talks. So he would have been talking no matter what. We did a Kenton walk. It was just really beautiful that way. Of course, we talked about topics that he would talk about, like trucks, work, fixing trucks, buying new trucks. It was just so him. We didn't talk about memories of him, and we didn't go down memory lane in that way, but we were living in the moment as if he was there with us, because he was there with us. When my husband and I pulled in, the car in front of us, their license plate said 361 KSD, and my brother's initials are KSD. And I was just like, thank you, Kenton, for being here. And he was the whole day. After the walk, we went to my mom and dad's, and Miranda joined, and it was like he was there. Miranda's truck needed a little bit of work. My husband goes, okay, well, when we get to Dawn's mom and dad's, we'll go in the garage. I'll take a look at it. I'm sure her dad won't mind doing this either, and we'll just fix your truck for you. We get there. We say hi to my parents, and all of a sudden my husband's like, okay, so this is what's going on. We're going to go check out Miranda's truck. Just as if my brother was there, because he loved to fix vehicles all the time. He was always working on things like that. Always seemed like a truck or something was in the garage and he was fixing it. So it was this beautiful reminder of him, but in the present. Like, he was just there with us all day. I thank you, Kenton, for being there today. It was so beautiful to have your energy and your soul and spirit around us as well. And I thank the mom, Wanda, who has lost her son, who puts this on for all of us to be a part of and allow us to be there for her. And today was her birthday. And what a better way to spend your birthday when you are missing your loved one, to have other people there that are walking in memory of not only your son, but their people as well. And it was so beautiful. I thank her for all the hard work that she does on this program. We get to take home sunflowers, which is always the flower that my brother would give my mom. We always take one for my mom. Oh, I was like, Ty, you can pick out a sunflower for grandma. He picks this beautiful sunflower, and no word of a lie, it has maybe 6, 7, 8 sunflowers on it. It was so beautiful. So he gave that to her, and then we got one as well. And then we always get a little baggie and a lanyard that says who we're walking in memory of. And it's just such a beautiful experience, and all the work that the high school kids do to put it on, and all the work that Wanda does to put it on. It's just so beautiful, and the scenery is so nice, and it was just a great day. It was a beautiful day of getting to spend time with my brother in a different way, and I love it, and I'm so grateful and blessed when we get days like that. I do want to put a trigger warning on my podcast today. It is going to be a heavier podcast. We are going to be discussing pregnancy and infant loss, as October is Pregnancy and Infant Loss Awareness Month. Trigger warning, if you don't want to be a part of this, please, you don't have to. I just want to let you know before we get any further. If you've experienced child loss, if you've experienced pregnancy loss, I want to personally send you my love and let you know that I hear you and I see you and I love you, and I wish nothing more that it didn't happen, but I want to give you that love that you may need in this time. I saw a quote a few days ago, and it's just so fitting for this podcast. So the quote says, "October is Pregnancy and Infant Loss Awareness Month. So many women have cracks in their hearts from a time they were completely broken. We should talk about it more. We move forward as we find joy and purpose and even hope. But those cracks never fully heal, and we don't want them to. They've changed us, strengthened us. There's beauty in those cracks." End of quote. The only thing that I would like to change in that quote is it's not so many women, it's so many parents, grandparents, siblings, relatives that have the cracks in their hearts. I do agree that we need to talk about pregnancy loss and miscarriages and infant loss a lot more than what we do. I personally experienced pregnancy loss, and I want to go through my story and share it with you. But before I do that, I do want to give just a little bit of basic information, maybe that you're unaware of if you've never been through this. Or I do want to say that I am not a medical professional, and at no time am I giving medical advice. If you need medical attention, please seek out your medical provider for any reason. I'm here to share my story and what has helped me along this journey of pregnancy loss. And I personally think that this topic is not spoken about enough, but happens more often than the collective sees. I also believe we should be talking about this more so that we as a collective can see how common pregnancy loss is. Even through talking about it doesn't lessen the grief involved with it, but it may help reduce the isolation, the self-blame that may come with pregnancy loss. So before I get into my personal story, just a few facts and some things that I was able to pull up from the internet. What is classified as pregnancy loss? Miscarriages are typically referred to as a spontaneous loss of pregnancy before 20 weeks of gestation. There is a stillbirth, which is classified of loss after 20 weeks of gestation. And there's early pregnancy loss, which is known as very early chemical pregnancy. So these losses are also common. Chemical pregnancy is a type of very early miscarriage that occurs when a fertilized egg implants in the uterus and produces the pregnancy hormones, but the pregnancy is lost before it can actually be seen on the ultrasound. So typically within the first 5 weeks. Pregnancy loss is 1 in 4 pregnancies, not 1 in 4 women but 1 in 4 pregnancies, which means that a woman can experience a pregnancy loss more than one time, more than 2 times, 3 times, whatever the case might be. And also the partner will be experiencing that along with them. Just something to take into consideration. When I had my miscarriage, I didn't realize the number was that high. And you think, okay, 1 in 4 women, but it's not women, it's pregnancies. For mothers that have experienced pregnancy loss, research shows that effects after pregnancy loss may cause that the mom could be very shocked to hear the news. Obviously, that makes sense. There's going to be maybe some guilt and some shame as causes are unknown, and there's myths around pregnancy loss. There could be anger. There could be elevated rates of anxiety. There could be depression. There could be stress and PTSD symptoms. The mom could be experiencing numbness or profound sadness. And many mothers have been noted that they have lasting questions. Why did this happen? What did I do wrong? That type of thing. And grief triggers such as like anniversaries around the baby or seeing other babies or prenatal test dates could trigger grief as well. Fathers also experience grief. And this is something I don't know if a lot of people really realize, but the father themselves can experience their own type of grief, which is usually less visible, and sometimes it is actually minimized by others or by the collective, because the man has to, in quotations, be strong. So they just suppress their emotions, they suppress it all, hide it, and they're the strong one for their spouse, and they're the strong one for the family. Studies show that fathers can experience depression and anxiety as well, and couples may grieve differently, which could create distance between them unless they are effectively communicating openly. Many miscarriages, especially early ones, stem from chromosome abnormalities in the embryo. There could be other causes such as uterine structural issues, maybe certain infections that you weren't aware of. There could be hormonal problems. There could be maternal health conditions that maybe you're not aware of until you got pregnant. However, unfortunately, a cause is never really usually found, which can just fuel the guilt of the parent or the mom or the dad, but mostly the mom feeling that they did something wrong. Some common myths that may surround a miscarriage is if you're lifting a heavy object, stress may cause a miscarriage. Minor physical activity might cause a miscarriage. Previous oral contraceptives may cause a miscarriage. These are not established primary causes for miscarriages. So they're not established. We don't know that if you have stress, it's going to cause a miscarriage. Maybe it does, maybe it doesn't. There's a lot of misinformation, which increases self-blame for the mom, for the father. Providing accurate information reduces the shame in having a miscarriage. When you have a miscarriage, there are a couple of different options that the doctor may provide you. So you're sitting in the room, the doctor informs you of this miscarriage, or you're at home and all of a sudden you're like, something's going on, and you go to the doctor and they inform you that you're having a miscarriage. You can do what is known as the expectant management, which is allowing the miscarriage to pass naturally over time, which can actually take a few days or weeks. In this time frame, your healthcare provider should be providing follow-ups with you and staying in contact with you and monitoring you. And of course, if something comes up, you better seek immediate care from them. There is another one, which is known as a medical management, which is where you use pills and you take them at home. And this helps the uterus to expel the remaining pregnancy tissue. Or there's the surgical procedure, which is a D&C. And this is where they remove any of the remaining pregnancy tissue from your uterus. Typically with a D&C, this is the quickest method and it may involve the least amount of bleeding. Your medical provider should also be providing emotional and physical care. However, in my opinion, I do not see that this is given often. I know when I went through mine, I was not given anything in regards to emotional and mental care. there was nothing. It was like, here's your 3 options and see ya. But we will get into that in my story. If you are thinking that something is up, if you're pregnant and you don't know if you're having a miscarriage or anything, go see a medical provider if you have severe bleeding. If you have bleeding at all, I would say go see them. Again, I'm not a medical provider. Do not take my words as medical advice. I'm just letting you know what my opinion is. So I believe that if you have any severe bleeding, any bleeding at all, meet with your medical provider. I wanted to go over a little bit of that information just so that when I tell my story, you have a good idea of what I'm talking about. I'm just going to tell you my story now. My husband and I, when we got together 16 years ago, we early on were trying to have a kid, and we tried and tried and tried, and we're just like, okay, it's not working. Obviously, one of us can't. And we didn't want to get tested because we never wanted to put blame on the other person. And to be honest, if it was me, I didn't want to carry that burden of knowing it was me. It was easier to say, we just can't have a child. Like it's a we thing, not an I thing, not a you thing, but a we thing. And so we decided we're not going to have kids. My husband had a son, and when I got together with my husband, his son was 10 years old, and I was happy being in his son's life and to help him go through high school and middle school and all of that, and to help him grow and to see him into early adulthood. I always said I had my brother and I had my stepson, and that was enough for me. And my brother was spending a lot of time with us, and I was okay with that. He was a young adult and he was out a lot, and it was like having a kid. You know, you're still taking care of him, you're still giving him advice and being supportive and helping him out in any way you could. And I was okay with that. I had a very close relationship with my brother for most of his younger years. Obviously, I was a teenager going into young adulthood, so I experienced that part of it too, of leaving the nest and, you know, coming home and all of that, right? But I always held a very close relationship with my brother, so I always felt that part of my mothering was good. When my brother passed away, and I'll tell this in my story of my brother's passing here coming up in a couple of weeks, but when my brother passed away, I don't know what reason, like the chaos, I don't know what it was, or just I knew in that moment that my brother wanted me to have a kid. And so I looked at my husband, and I think my mom was there, and I said to them, I said, okay, this is how Kenton makes us have a kid. And from that moment, because it was minutes later that my brother had passed, my husband and I think at that point we're on the same page that we were going to have a kid. And so a week later, after everything that happened, you know, the funeral, everything, we were hosting everyone out at our house one last time. So we were going to get groceries. And my husband said, he goes, are we doing this? I was like, yes, we are. Meaning like, are we really going to have a kid? And I was like, yes, we are. Now, we are not 30. I was in my late 30s. My husband was in his late 40s. There's an age gap between us. He already has a kid. So we decided, yes, this is what we're doing. And we started trying right away. We tried for 26 months to conceive. The day that I conceived, I was in shock because I had so many months of heartbreak, so many months of tears, so many months of frustration and anger. And I was so mad that I couldn't get pregnant. I tried body talk. I tried Reiki. I did all the things that I could do, changed my diet, like all that stuff, but we just could not get pregnant. I went to a medium and we talked about my pregnancy, and she goes, I see it coming, but I can't speed up the timeline. Like I cannot speed it up. Like it is going to come when it is meant to come. There's no way of speeding this up. It doesn't matter what you do, you cannot speed it up. And I was so mad at her. And I remember too, because I always believed it was going to be my brother's soul coming back. And she told me it wasn't going to be my brother's soul. And I was mad at her. I literally left there and I was mad. And I went to my Reiki master, who they are best friends. And I was like, this is what she said. And my Reiki master's like, no, it'll be your brother. And you know what, we'll still work on cleaning out your energetic system and all of that. And I was like, okay. So 26 months later, I get pregnant. I'm ecstatic. I'm excited. We go to our ultrasound. We see our little being in there. You know, we see the heartbeat, everything. It's real. It really is there, because up until then, you're like, is this real? And we go through, and I've had, you know, maybe a doctor's appointment after that type of thing, maybe 2, I can't even remember. And just before 12 weeks, my husband and I went to go pick up a dresser for the nursery, and it was used. So we go to my old town, what are the odds, and we get it and we bring it into the house and stuff. And then the next day I was spotting, and I'm like, oh boy, it's because I lifted that dresser, right? Again, that myth of lifting something heavy. So I was like, I lifted that dresser. Now I'm having a miscarriage, and it was a Sunday. So I said to my husband, I said, I'm going to call my doctor and I want to go in. And he's like, okay. So we go in. It wasn't my doctor, but there was a doctor. It's a medical center, like a Mediclinic. So we go in and the doctor's like, well, I'll try doing the fetal Doppler and see if we can hear the heartbeat, but you're really not 12 weeks yet. We might not be able to hear the heartbeat. And I'm like, okay, so we didn't hear a heartbeat. I don't know what to listen for. I don't know anything what to listen for. I've never heard a fetal Doppler before. I've never experienced this in my life, so I don't know what I'm listening for. So of course we don't hear the heartbeat. And she's like, well, we didn't hear a heartbeat, but you're still pretty early. It's pretty hard to tell. Let's book an appointment for tomorrow. I go in for my ultrasound the next day, and my husband comes with me. It was later in the afternoon. I remember he comes with me and we're in the ultrasound, and it wasn't the same as before. The tech wasn't talking. They weren't saying anything. And I'm like, okay. And he's like trying to like see if there's like a heartbeat or anything like that. And, you know, she's very like non-emotional. She's just focused and not saying anything and whatnot. And afterwards they're like, okay, well, you guys can wait up here and then we'll get your doctor to go over your results with you. We waited probably an hour and a half. I don't think that we should have waited. And I know that there was probably a patient prior or patients, but please slot us in. It's already nerve-wracking for us. Please slot us in before those. Maybe make them 15 minutes late. I don't know what to do, but we literally waited an hour and a half to see her. Finally, the doctor can see us, so we go in and she comes in and she goes, I'm sorry. She goes, but you had what is known as a missed early pregnancy loss. And she has tears. And I said, okay. And she goes, it looks like your gestational period would have been 7 weeks and 2 days. And in my mind, I'm like, we came in at 7 weeks exactly. So you're telling me 2 days after I was here, I had a miscarriage? And my body didn't release anything until almost 12 weeks. So my body held on. I didn't know that I had miscarried. I wasn't really sick in that time frame. I was tired, but not tired. I don't know. It's different for everyone, right? And I didn't really have morning sickness or anything like that. I experienced a little minor bit of back pain, but nothing crazy where I would have been concerned about it. I was like, oh, it's just how I'm sitting in my chair, or, oh, I'm standing a little bit too much for work. I remember I looked at her and I said, what are my options? Like, what can I do? And she goes, well, you can pass it naturally. She goes, I can give you pills that you would insert and in your cervix, and then you would expel everything. She goes, or we can schedule a D. And I look at my husband, and we had a trip planned. It's our annual Easter snowmobile trip at this point. And that's the other thing. Like, I looked at her too, and I said, did I have a miscarriage because I went snowmobiling? She goes, no, it has nothing to do with that. I'm like, are you sure? She's like, it has nothing to do with you snowmobiling. You did not have a miscarriage because of that. And I was like, okay. So I look at my husband and I'm thinking, well, I don't know. I said, how long if I waited naturally? And she goes, it's hard to say. She goes, your body could keep it for quite some time. I said, well, I will do the pills because we're literally leaving next week. So I don't want to have to schedule a D&C, which could take a couple of weeks. So she's like, okay. So my husband and I, we walk out. Obviously, we're crying. Obviously, we're upset. He's like, are you okay? And I'm like, yeah, I just got to deal with this. I go to get the medication, and it's surreal, right? Like, you're sitting there and you're trying to navigate the world still. You're trying to be a part of the world when you have this information. And I get my pills, and I remember I had to make that text message to my manager, and it's not a call. I know she usually wanted a call, and I was like, I'm not going to do this call. I'm just going to text her. And I text her right away, and I said, hey, I won't be in for the next little bit. And I had my doctor write a note saying that I wasn't going to come in. And I said, I'll give you the note, but I said, I'm going to take this time to heal and to go through this process. And she was really great at that point. You know, she was sorry and really heartfelt was sad for us because I had just announced that I was pregnant to my work team a couple of days beforehand. So I got the pills and I came home and I inserted them in my cervix later that night. And I remember, oh my God, the pain I was in, the immense pain. It was a menstrual pain, but like something I have never in my entire life felt. So I thought, well, I'll put this in and I'll go to sleep. It'll be fine. Yeah, no. I stayed up on the couch, heating pads, drinking red raspberry leaf tea to try and help the pain. I was taking Advil. I was leaned over crying in the middle of the night in so much pain from this ordeal. As I'm doing this, of course, I start my period at that point in time and I'm bleeding a lot. And they told me if you're bleeding and it's toonie size and you're filling a pad this often, you should be coming into the hospital. In the morning, I looked at my husband. I said, I need to go in. I'm getting big blood clots out. I said, I'm not comfortable. I don't know if I'm hemorrhaging. I'm in massive pain. We waste half the day at the ER and I tell him what happens and I'm supposed to take another dose of this medicine. And I'm like, I don't want to. So I asked him, I said, do you think that I need to? I said, like the amount of pain that this caused me, do you think that I need to? And so they were talking to me and they're like, I don't think so. Like, it sounds like you would have passed all of that. And I was like, okay, sounds good. I think on Wednesday, I had to go back to my doctor and I told her what happened. I said I went to the hospital and it wasn't hemorrhaging or anything. She's like, okay. And I was like, I didn't take the other set of pills though. And she's like, okay. I said, they told me that I passed it. And she goes, well, by the sounds of everything, you did. I go home and Friday we have to go 3 hours away to pick up our new vehicle before we literally are leaving Sunday on our snowmobile trip. And that morning before we're leaving, I go to the bathroom and all of a sudden as I'm peeing, I'm like, that is the weirdest feeling. I'm like, there is something there. So I like call my husband. I'm like, Tim, of course I go and I pass the birth sac. I didn't pass the birth sac. It literally took me 4 days later to pass this. I would like you to know this part's going to be a little bit more in depth and more detail, and you may not want to hear this part. Fast forward a couple of minutes. It was the birth sac, and you could see the body forming. Now remember, I was only 7 weeks when my miscarriage happened, and by this point, I'm 12 weeks. But you could see a little head. You could see the start of the body forming, little arms sort of starting to form. Like you could see that part of this in the birth sac. And I was like, my gosh. And so of course I passed this and I'm not going to tell you what I did with it, but we end up going to go pick up our truck. And the whole time I'm like, that just happened. And I'm feeling a little bit frustrated with the healthcare that I got. My doctor said that I had passed everything and everything was fine. The nurses said that I did. The doctor at the hospital said that I did. The one nurse at the hospital, she did have a miscarriage and she was so sweet and so kind. I felt really dumb going in and she's like, don't. She's like, this is a lot to be taking in. And she told me that she personally had a miscarriage. And she said one thing that helped her was going and reading books about it. And she said, do remember your husband is experiencing this as well. Something I never really fully took into consideration was that my husband was going through this loss as well. I mean, it was 26 months that we tried for our child. And then within 2 months of finding out that we were pregnant, we lost our child. He was going through those emotions as well. And it was so great to hear that. And it put a lot of stuff into perspective. But I remember how frustrated I was with the medical system for not realizing that I still had a birth sac and that I hadn't passed it. And I just said to him, I said, what would have happened? I said, if it wasn't at home, if we were driving to go pick up our truck and I stopped and went to the bathroom when we got to the dealership, what if it happened when we were driving to the mountains in a week's time? What if it happened when we were in the mountains? What if it happened when I was snowmobiling and I had to use nature for my bathroom? I just was very frustrated in that moment with my healthcare system. I'm grieving. I'm upset. I'm frustrated. I'm mad. I feel like I caused this to happen because I went snowmobiling. Some people knew that we were expecting and some people didn't know that we were expecting. Because I was so close to 12 weeks, I thought it was okay to put it out on social media. And to be honest, I am grateful that we did put it out on social media. The hardest part was the day that I found out that I miscarried. I had to come home and make that post on social media that we had a miscarriage. And I did that. I didn't have to, but I did that because I didn't want to be asked. At that point in time, I was like, what would be worse, having to make this post, or 3 months down the road, having someone ask me, or 3 weeks or whatever. So I put the post out. I just remember how I felt alone in this whole aspect. I went back to work, and at the same time that I had a miscarriage, another lady in my department had a miscarriage. She messages me, and literally, I think we're within days or the same day of each other. And we came back on the same day anyways. It was nice to have that person, but at the same time, we didn't talk about it. I felt a little less alone, but we didn't talk about it. We didn't discuss how it felt or anything like that. And so I still felt very alone. I did have a really good friend who had gone through a miscarriage previous. She was helpful and she told me of a book. It's called Spirit Babies: How to Communicate with the Child You're Meant to Have by Walter McChinnon. Tuesday I went to the hospital. I think I downloaded it on my Kobo. Then I liked it so much. It was such a great read and I spent a day just reading it. It's an easy read and I just absorbed it all, and it helped me not to feel so alone. It helped me to understand the spiritual side of having a miscarriage, and that it wasn't just me, but there is the soul involved. The baby soul is involved. The spirit baby is. I was so intrigued by that book that I had to have a medium read for my spirit baby. I found a lady in Saskatoon and she did a reading for me. Beautiful, beautiful soul. Just so beautiful. And in that reading, I won't tell you much about it because I don't remember a whole lot about it. But she did say that the spirit, she goes, you feel that it was one gender, didn't you? And I said, yes, very strongly. She goes, it's not. So that gender changed. And I'm like, okay. I really thought that I was going to have a girl and I ended up having a boy. I wonder if that part of it was they didn't want to be a girl. And they were like, yeah, I'm going to come as a girl because that's what she wants. And it's like, no, I do not want to be a girl. I'm coming in as a boy. Or was it just timing, astrology reasons and purposes? Was it lining of everything, making sure that it was 100% perfect in that time frame? She said, you'll be pregnant and it'll be the same soul. That's always nice to know that the miscarriage that I had is the same soul. And she goes, she's so funny. She goes, I'm also getting, she goes, that the spirit baby is spending a lot of time with your brother. My brother was taking care of her spirit baby ever since he was there. So that was great. Loved it so much. And then she goes, I'm also getting though that he's coming too. Your brother's coming too. And I was like, what are you telling me? She goes, I don't know if that means you're going to have twins. She goes, but the soul of the spirit baby that you lost is not your brother. And part of my 26-month journey of being able to get pregnant was I had to release the idea that it was going to be my brother's soul. I had to come to terms that there was going to be another soul. And literally the day that I said that, I think 2 days later, I found out that I was pregnant. She's like, yeah, he says he's going to come. And I was like, oh my gosh, please tell me I'm not going to have twins. Like, I'm not capable of dealing with twins. Like, I just know that is not in my capabilities. And I was like, oh my God. And then I think it was a month after or a couple weeks after having my reading with her, I ended up being pregnant again. I went for a 3-month time frame maybe where I wasn't pregnant. I did so much work on myself spiritually. I went to body talk. I was working so much on cleaning out the energy from the spirit baby, the sadness, the sorrow, the grief, so that I could allow in the spirit baby again, but also so that I would be okay with it when it did happen again. I didn't get Reiki done after my miscarriage because I didn't have a Reiki provider. Unfortunately, my Reiki master passed away before I was pregnant. She had worked with me so much on getting my body ready and my soul and my spirit and my mind ready to accept being a mom, but she never got to see the text of me saying I'm pregnant. And even to this day, it does make me sad because we worked so hard on it. And she was the one that, and I don't know if it was my second or third session, but I felt a baby in my stomach. Like I literally felt a baby moving in my stomach. And we talked about it and she goes, are you and Tim done having kids? Like, are you guys going to have a kid? I said, no. I said, we are not having a kid. Like we are adamant at this point in time in our journey, we are not going to have a kid. She goes, no, you're going to have a kid. And I said, no, we are not going to have a kid. There is no possible way we are going to have a kid. My brother was still alive at this point in time. And so when my brother passed, I went back to her and I said, you're right. We are going to have a kid and we are trying. And she goes, I knew it. She goes, I knew you were going to have a kid. And that spirit baby was so strong. And so when I got pregnant again after my miscarriage, I worried. I worried a lot that I was going to miscarry again. I changed a lot. I ate differently, did moderate exercises. Not that I was working out hard when I first found out that I was pregnant. I still did stuff. I still made sure that my body was healthy, that I was strong. But I knew at that point in time that it didn't matter what I had done. Because I had that reading with the medium, I knew it wasn't me. It wasn't what I did. It's just that spirit baby just decided one day that they weren't ready. They truly weren't ready. And as hard as it was for me to have to go through that, it's just what happened. And maybe we had wrote it into our stories that this was going to happen once. I don't know. Maybe we did. Maybe it was something that just came out of the blue and we didn't write it before I had come to Earth. Maybe it was something subconsciously after I was here that we decided on our free will terms that we would experience this. I don't truly know that part of it. I do want to backtrack a little bit to the day that I got my PAP done. So it would have been my 15-week appointment. I remember walking out of the doctor's office and I get a text message from one of my friends at work and I was like, oh, awesome. And in that text message, she informed me that she was pregnant and that she was due late October. And I'm like, my child that I had lost was due around the same time. And the crushing that I felt, the heartbreak, the tear of my heart, it broke me beyond anything. How do you text back and say, oh, I'm so happy for you? I mean, I did because that's what you're supposed to do. But I was standing by my truck in tears because of this. And I felt so alone and lost and like my situation wasn't even cared about. But then at the same time, I look at it from a wider lens. And I was like, we worked in the same department. So within a couple of days, it was going to be announced that she was pregnant. And she was probably doing a hard thing on her end too, to be like, oh my God, she just lost her baby. Her baby was due right around the time that I'm going to have a baby. We would have been pregnant together, but I should probably tell her before I tell everybody in the meeting where you probably would have seen my face and it would have been broken. So I'm grateful for what she did, but at the same time, it broke me. And that's the part of having a pregnancy loss or losing a child, is that people don't understand and you're going through so much of it on your own. You feel isolated. When I announced it on Facebook, there was some people that came forward and were like, I had a miscarriage too, if you need to talk. And I never felt comfortable talking to them. I felt like I had to do this in silence. I felt like I couldn't tell my story. I felt like nobody cared about my story. I felt that it happens so often. I mean, 1 in 4 pregnancies, but I felt alone. Did my husband and I communicate a lot? We did. We communicated very well. I remember at one point we had already bought our monitor. He wanted the Owlette. I had it in the truck one day and I said, we have some time to go back and get a store credit or whatever. Or if we go back now, we'll get the full refund. And he goes, just don't feel like we should. He's like, then I feel like we're giving up. And I was like, I agree with you. So we kept it. It's one of the hardest things that you're going to have to go through. And, you know, being at the walk today with parents that have lost a child and being a parent that had a miscarriage, and how many of those parents was that maybe their rainbow baby? You don't know. It is a situation where we do feel isolated and we do feel alone and we do feel that we have to stay strong and that we have to do this on our own. And the truth is, you don't. You don't have to at all. Try and find someone that you can talk to about it. Even if it's a counselor, if it's a therapist, if it's a really good friend that is willing to hold space for you to process this, if it's your significant other. But you need to know that you didn't do anything wrong. You didn't cause that to happen. And I truly do believe that getting the reading from the medium was a huge change in how I looked at it. I was able to come back and say, okay, we are meant to have this kid. And I think part of it was because my husband and I had tried for probably a year or a year and a half, way back when we were first together. And then it took us 26 months when we tried again, that it felt like when we had the miscarriage that I just wasn't supposed to be a mom. And I don't know how many women feel that they're just like, it's just not supposed to happen. And I mean, especially if you have multiple miscarriages, you could definitely feel that. Like, I could see that and appreciate your feeling for that. I can see where that comes from, definitely. And the truth is, keep going, keep trying. It could just be spiritually that child knows that right now it's not meant to be, that the world isn't what they want to come into, that they don't want to deal with this situation, that, they just want a different entrance maybe. Maybe the stars aren't aligning properly or something like that. It doesn't mean that you're not supposed to be a parent, and I want you to know that. What also really helped was the book of Spirit Babies, How to Communicate with a Child That You're Meant to Have. It was such a beautifully written book where I didn't feel alone, where there were people that were going through the same situation I was, where there was people that it took a long time for them to conceive. There was people that went through the miscarriages, and you just saw on this spiritual perspective of what is actually happening on the other side. It's not just me. It's not just my husband. It's not just an egg and a sperm that's making a child. There is a soul involved in this. Timing, all of that kind of stuff. There was even a story in there where one of the spirit babies wanted a quieter place to live. The mom, I don't know if she had a miscarriage or if it was taking a long time for them to conceive, so she went and saw this medium. And he said, your spirit baby doesn't want to live in the city. It's too noisy. And the husband and wife lived in the busiest part of the city where it was super noisy, super loud, sirens going off all the time. And previous to the lady going in to see the medium, her husband was discussing how he thought that maybe they should move out to the country where it was a little bit quieter, a little bit calmer. And then when they had their little girl and they would come to the city to visit their grandparents, she would literally cover her ears and say it is too loud. And until they moved and made that change, that baby wasn't going to come because it wasn't in the right time frame. It wasn't in the right aspect of what they needed for them to live out their soul contract. You could do a lot of modalities to help yourself get ready for a child. You could do bars to open up the mind. You can do body talk, which would help your whole body get ready. I did that after I had my miscarriage. I went to body talk. We cleared out the energy of that soul, because anytime that you're holding a baby, that energy stays. We cleared out my grief and my hurt. We got my body in alignment to be able to conceive a healthy child. And throughout my pregnancy, I did go to body talk quite frequently. Just before I had my son, I went to bars to get over my PTSD from hospitals from when my brother passed. I can Reiki myself. Reiki, when you are pregnant, helps calm you, which then helps calm your baby. So your baby's getting all that loving, beautiful Reiki energy and source energy as well. Reiki would provide you with relaxation and the ability for you to actually be able to sleep. So if you're having problems sleeping, Reiki might be something that you could look at. With Reiki as well, you can do distance sessions, so you don't have to physically be there if that's not something that you're comfortable with. If you're getting further along in your pregnancy and you don't want to go out, you can have a distance session done. You can be in your own bed at home or taking a bath or relaxing somewhere that would be comfortable for you. When I started working in the Akashic Records, I can see now the soul part of being a mom and the soul part of bringing in a child, and how having an Akashic Records reading done when you have a pregnancy loss would be beneficial in the fact that you may be able to tap into what was going on in that situation. If you don't know, the Akashic records are described as a non-physical energetic record of a soul's journey. It's a place where practitioners could access and receive the insight and guidance or messages about life themes, accessing information to help a client find meaning, release stuck emotions, limiting beliefs, and negative patterns to receive messages from a soul level. People have used the Akashic records by reaching out to a practitioner to ask them why the loss occurred from the soul's perspective. They could receive messages which could maybe ease some guilt. They can connect with a child's soul as well, obtain guidance for the healing that the mother should be doing at that time, or even if it's a father that reaches out. The Akashic Records reader could as well identify emotional blocks. Some clients that have had Akashic Records reading done after a miscarriage or pregnancy loss or child loss have described it as transforming grief into a relationship with the child's continued soul presence. I feel like that's what I did when I got my reading done with the medium. The Akashic Records approach can be deeply comforting to those who resonate with it. I wish that I knew an Akashic Record reader back then to have the records read for myself to find out if I had limiting beliefs, because that's the thing. I could have been stopping this from happening because of my own personal limiting beliefs. There might have been something where I didn't feel like I was going to be a good enough mother, or I didn't deserve to be a mother, or whatever the case might be. I might have these limiting beliefs of my own that I'm not even aware of, and that stopped me from having my child at that time. That's what the Akashic Records would do. It would help you to understand your side. The Akashic Records could bring up the whole part of the energy of the soul baby and find out that connection for you and give you that information, which may, again, help with any grief that you may have or guilt. I do believe seeking even the Reiki part of it, just to help you with grief and processing those emotions, cleaning out those emotions, and realizing that you didn't do anything, and helping you through that point. Almost in a way, your Akashic Record reader or Reiki master could be almost like your therapist, and they would hold space for you, and they would be there for you to have those discussions and to talk about that and to help you move through all of those emotions that having a miscarriage does bring. I want to say, if you've experienced a pregnancy loss in any way, if you've experienced a child loss in any way, I am so sorry for what you have gone through. And I know that we talked about pregnancy loss in this podcast, but this goes for child loss too. You could always reach out to a practitioner, a Reiki master, an Akashic Records reader, to help you process the feelings that come with grieving a child in any capacity, whether if you just found out that you were going to have them, if you had to birth them and they weren't alive, if you've lost them within short months of giving birth, or if you've had years with them and lost them later on in life. I am sorry that you've had to experience that, and I want to give you love. And I want you to know that I am here for you, and I hear you, and my heart breaks for you. Reiki and Akashic Records would and could provide a lot of clarity for you, healing for you, and space for you. If you or someone you love is currently processing a pregnancy loss or has in the past, consider combining clinical support with layers of care. So with different type of energy modalities. A trusted medical provider, a mental health care provider, you should definitely try and seek out a perinatal bereavement counselor. I didn't even know that that was a thing. That probably would help a lot of women if we were informed of a perinatal bereavement counselor. Maybe it would take away a lot of stigma. Maybe it would take away a lot of guilt, shame, hurt, a lot of depression, anxiety, anger that comes with losing a child. Look for some peer support groups. And if it resonates with you, look at spiritual practices like Reiki, like Akashic Records, but find yourself a compassionate, trauma-aware practitioner. I am hoping in the next little bit to create a short guided meditation. And when I do that, it'll be a bonus episode. But this meditation would be for anyone that has experienced a pregnancy loss of any kind, or a loss of a child, or anyone that has some grief for a loved one. I hope that through this podcast, you were able to find some clarity, that my story may help you, even if it makes you feel less alone. There are so many women that have experienced the heartache of pregnancy loss, and not just women, but women and men and family units that have experienced pregnancy loss and child loss. And it just goes hand in hand. Today, when I was at the walk, I looked at mothers and fathers who have lost their child. Yes, they were earthside for a while and they lost them, but I don't think that the pain is any less when you have a miscarriage or a stillbirth. I do believe that it is something that we should talk about more. I believe maybe we're afraid to talk about it because we don't want to make the other person feel uncomfortable. Are we afraid of dealing with other people's emotions, or are we afraid of maybe saying the wrong thing and hurting someone else's emotions? And I know this podcast was hard because I was like, I have to think of everybody out there and what I'm saying. And of course, I'm worried that anything beyond my story in this podcast could trigger someone, could hurt someone. And obviously, that's not my intention. My intention is to show you that you're not alone. My intention is to give light for maybe people that don't know anything about pregnancy loss in any capacity. Up until I was that person, I didn't know, because it's not talked about. It's not something that people talk about. They just don't. And even if it's happened to them, they just stay quiet and they blame themselves and they go through this guilt and this grieving process all alone. And I don't think we should. I just don't think we should. I think that we should start talking about it. What would make me less of a person if I talked about my pregnancy loss journey? What would make me less of a person? I have every right to talk about it. I do believe it's the same thing with child loss. Or loss of any kind, even if it's, your parents, a sibling, I'm thinking of like when you're older, uncle. It doesn't matter. We don't seem to have the ability to have that conversation because people are uncomfortable by it. Why are we uncomfortable by it? Let's really look at it. Is it because we're uncomfortable of their emotion if they were to talk about it? Because we can't handle that emotion? Are we uncomfortable because we don't want to remind them? Trust me, they know. I look at my son every single day and I think I'm so blessed to have him. And I am blessed. I'm so blessed to have him. And I see that there are a lot of people that go through life and they go through these challenges and they know how blessed they are. And it is beautiful. And we got to look at, sometimes we need the duality. We need to have, yes, the light of having a child. But would we appreciate that child as much if we didn't lose a child? Do you know what I mean? Like that duality, right? Light and dark. You need both sides to know that we like light over dark. If you never had dark, you would never be as grateful for the light, as welcoming for the light, as joyful and happy for the light. So do we go through a dark period for that reason? I don't know. I'm just thinking about this right now. There could be so many reasons, and I just want you to know that you're not alone. And if you want to talk, I'm here to talk with you. I'm here to listen to your story. I'm here to help you in any capacity that I can. I will hold space for you, however that looks for you. I want you to know that you're not alone. I want you to know that the grief is real. I'm never going to say that the grief isn't real. The grief is real. But you have a person that's willing to hold this space for you, and a person that understands what it feels like, and a person that just wants to give you a hug and love for that. Just know that you're loved. I'm sorry it was a heavier topic today, but I love you and I thank you for being here. And I do think it is something that needs to be shared. It truly, truly needs to be shared with the world about pregnancy loss and all that is really surrounding it. So again, it's not just you going through it, it's your significant other going through it as well. And if you have never experienced it, know that it's two people going through it, not just one. And just be there for them as much as you can. Know that I love you and I thank you. And I will work at getting that meditation out before the end of the month so that it can help you. I love you and thank you so much for being here today.